The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the Weymouth Community Access staff or its board of directors. WCA, in compliance with FCC regulations, is prohibited from exercising control over the content of independent member-produced public access programming.
And welcome to the show once more, and thank you for joining us. I have somebody new, cool, calm, collected. Elizabeth. Elizabeth's last name?
Capozzoli.
Capozzoli, because I said to Nikki, how do I pronounce that name? Capozzoli. Okay. Elizabeth, you're here because, not because you're not bright, beloved, beautiful, but you have a job you do for who? Where do you
Dr. Richard Wolfert
Yeah.
in South Weymouth.
Good. And you've been a hygienist for, you had an interesting story.
22
Single mother.
years.
22 years.
Yes.
You've been with Dr. Wolfert how long?
Over 14.
14. That's a long time. You
Yes.
look in people's mouths, right?
Yes.
Okay, I said to you on the phone, Elizabeth, my mouth is open. I haven't a clue what she's doing or what you're doing. So tell us, first of all, why do people have to clean their teeth? Why should you have a cleaning and how often?
Okay. Well, it's how often depends upon the patient. Plaque, everyone gets plaque.
What's plaque?
It's a bacterial byproduct of our mouth.
Is it, do some get more than others?
Yes.
Is it because you have
It
softer gums?
depends upon your body chemistry, if you're on certain medications. It's various reasons why some people get more, some people have less.
Oh, I never even thought of medications.
But-
They could affect plaque?
It affects the mouth. Yeah,
Ah.
a lot of medications cause dry mouth, which can lead to cavities, but that's getting off track. So the
No,
plaque,
anything you tell people they're interested in.
with the plaque, it's the same plaque that clogs arteries and can clog your arteries. So it's very important to remove it from the bloodstream, which when it's sitting in your gums, it's getting in your bloodstream.
Who even thought of that?
Yeah, that's
So-
why, in fact, when I go for a physical and you fill out your medical history, this is for my primary care doctor, they ask, do you wear a seatbelt? Do you wear sunscreen? Do you floss?
Yes.
That's how important
My
it
primary
is
always
to
says
remove
me,
this
yes.
plaque. Most patients are, every 6 months,
Is
it's
it 6 months?
sufficient.
It's
Yes.
sufficient. And if you saw them and thought sooner, you would do sooner.
I would suggest that, yes.
Why floss? And flossing, any particular floss you like?
I like Glide floss.
Okay.
But
Thick,
basically, the floss will get down. There's a little space between your teeth and your gums. It's called the sulcus. And you can maneuver the floss to go with the shape of the tooth to get down in that area and loosen the plaque and remove it. So
Okay.
I always suggest that patients floss first, then brush, and then follow up with the antiseptic rinse.
And what kind of, any antiseptic?
I usually recommend Listerine because
Okay.
it's antiseptic.
eating
It's
this
going to
up, they
kill
would love it.
bacteria,
Okay.
and plaque is bacteria.
So Listerine, plain Listerine?
Listerine will continue killing bacteria for up to 90 minutes after you've rinsed with it.
Does plaque have anything to do with your diet, what you're eating, or it just comes no matter what you do?
It just comes no matter what you do. It's kind of job security for me.
How marvelous. So they call for an appointment with the dentist, Dr. Wolfert or his associates or him.
Yes.
And then he then says you need to have a cleaning? Or do people call up just for a cleaning?
With a new patient, he does a comprehensive exam, which is a full set of x-rays, periodontal charting, and then he determines what type of cleaning. Some people need a more aggressive cleaning with anesthesia.
Is that right? I
Yeah.
never even knew you could do. You had to have anesthesia to do cleaning. It would be that painful?
Some people, it's not common,
Yeah.
people that go regularly.
Yes, that's
You
the
know.
key then. Periodontal means gum
Gum
bleeding?
disease.
Gum disease.
That's when the bone has deteriorated. Gingivitis is inflammation in the gums. That's
And
a
you can spot
reversible
that.
condition, absolutely.
The other
That's
unique-
very reversible. That's when lack of home care and a lot of plaque causes the gum tissue to get inflamed and red, swollen, bleed easily. So with a good thorough cleaning, sometimes you need 2 cleanings. I'll do 1 cleaning where I pretty much stay above the gum line and get as much tartar, which is hardened plaque.
Do you have a piece you use for getting that?
Well,
I know you brought a few things in.
These are a basic set of instruments.
So you'll take them out and good. Because when I sit in the chair, you put everything on me and open my mouth and all that jazz, right?
Right.
And then, okay.
Well, we always open the instruments in front of the patient.
Do
That
you?
way they know that they're sterile.
Okay. Oh, I never even knew that. I don't think.
Yeah.
All right. Okay. And so you use a different instrument on each person
A different
coming in?
instrument for each surface.
Okay.
There's mesial and distal, which mesial is towards your midline, distal is going back. So this instrument,
Now let's hold
you-
it, Russ. Can you get that instrument? It's kind of tiny.
this
and-
is for the
Oh,
mesial.
beautiful. Do
and-
you want her to leave it on the table or holding it is okay? Okay. All right.
There's a smooth side, and that side is up against the gum tissue. The cutting surface is the other side. That's what's removing the tartar from the enamel. And enamel, people get nervous with the scraping sound, is the hardest substance in the body.
Is that
It's
right?
harder than bone.
How do you get it?
So you can't hurt enamel with these instruments. It's
Okay.
impossible, unless the enamel is decayed, in that case, a cavity.
And so, okay, so is that the first thing you do when I'm in your chair?
No, when you're in my chair, the first thing, greet you, and then we'd go over your medical history. Then I would do a oral cancer screening.
Oh.
I'd look everything over.
In my mouth?
In your mouth, particularly the border of the tongue. That's one of the first places that oral cancer will show up.
Is that, have
the
you
border
seen
of
it?
the tongue. I haven't. I have found suspicious things, and if we do, then we refer the patient to an oral surgeon, and they can have a biopsy. And
it
9
comes- I'm
times
sure
out of 10,
smoking.
it comes back, it's fine.
All right.
But better be safe than sorry.
Absolutely.
The thing with oral cancer is it is very treatable if it is caught.
If it is
So
caught.
that's another good reason to come every 6 months, because we are looking for oral cancer. Then I feel under here, I feel the thyroid, the inside of their cheeks, the lips. Make sure there's no funny lumps or nodules, anything that shouldn't be there.
And you can tell
Yeah,
by the feeling.
exactly.
Aren't you thorough?
You want things to be symmetrical. Sometimes a patient may have a cold, and you can feel a little swollen in the glands, but they're generally even. So then you know, okay, it's your cold.
And you put that thing in your mouth to get out the water while you're working the drain?
I do after, if the patient
Needs it.
Yeah. So then after that, if they're due for a periodontal charting, that's where we actually, this instrument,
Whoa.
I don't know if you can see, there's
Can you see
millimeters.
that? Russ is very good. Oh.
And we measure that sulcus that I mentioned earlier, the space between the
Yes.
gum and the tooth. It's also referred to as a pocket. And you want it to be 3 millimeters or under. That's healthy. 4 millimeters, okay, they need a cleaning. And chances are, once you clean them up, if you brought them back 2 weeks later, it would be a 3 or a 2. When you get into the 5, 6, 7 millimeters, that's an issue. That's when they may need that deep scaling with the anesthesia, or in some cases may even need to be referred to a periodontist.
A gum person.
Right.
Yes.
So there's 6 surfaces on each tooth that we measure and we record in the computer now because it was paperless. And then we can follow that up a year from now and see if there's been any changes, or even better, if there's been any improvements. It will show us.
Can you tell a smoker
Yes.
what happens to their
Usually
teeth?
you can smell it.
them. Smelling is awful.
But also there's called nicotinic stomatitis, and it's a fancy name for the roof of the mouth gets very white and gray.
Oh, awful.
Yeah.
Do people who smoke have more gum disease, more
Gum
cat
disease, yes. People get confused with the tartar in cigarettes and think it's causing tartar in their mouth. It's two completely different things. The cigarettes will stain.
Yeah, you
but
can see the
most
yellow.
damaging is to the gum tissue. That's the big concern with that.
And then, so you do that. What's the
So then we do the periodontal charting. Then I start the cleaning.
Okay, and I'm lying there. Meanwhile, you're starting the cleaning. Does it take like an hour, or a whole thing?
No, usually about a half
An
hour.
hour. Okay.
On a patient that
Yeah,
comes regularly
right.
and has good home care. Now, if they do not have good home care, one of the things I like to do is this disclosing solution.
Uh-huh.
And we just put a few drops.
Aren't you terrific?
Individually wrapped. Gotta
Okay.
keep everything clean.
Clean. I love your nails.
Oh, thank you. And so with this, I just rub this red solution,
So Russ is following you. He's terrific.
okay, along the teeth.
Okay.
And then I'll have the patient do one swish and spit with just water. And then we lay back down and I hand them the mirror and we look together with my little mouth mirror here.
Okay.
And we check all the surfaces of the teeth because wherever they've left plaque behind, it will be this bright pink color.
Oh.
And it's great because, especially with children, I mean, some kids think they're doing a great job, and sure, the back teeth are beautifully clean, but the front teeth, it's like pink sweaters, like your sweater.
Is that right?
Just covering. They're completely missing their front teeth.
Is it hard to get kids cleaning? Do they sit long enough until? And
They're good. Kids
good.
are quicker.
Yep.
It doesn't take as long, you know.
So you tell the child, or do you tell
I
the
show
parent?
them.
You show them.
And then they see, and then some children, I'll give them a 2-minute timer to take home.
Yes. Is
'Cause
that how?
That's the key, is they're not spending enough time. They're
So
in
when
and out.
an adult or a child brushes, what should the regimen be, Elizabeth? You said you like
Sonicare toothbrush, yes.
So it's the electric toothbrush.
That's the best.
It's the best.
That actually creates sound waves
Is that
in the
right?
mouth that will go under the tissue and break the plaque loose from the teeth. So
Do you sell it in
that's
the
a whole
office?
different technology. It's patented. It's the best one on the market. I've seen patients that use it, and the tissue improvement is remarkable.
Do you
The
sell that in
difference.
Dr. Wolfert's
We do.
office?
Yeah, we're able to buy some at cost, and then patients that I really feel should use it, we can sell it to them at cost, which is
Excellent.
like half the price
Excellent.
retail.
But if they're out, they should get that one. And
Yes.
So, and you said you give them a timer, so 2 minutes with the Sonic?
The Sonicare has a built-in timer,
Uh-huh.
which is wonderful. I know myself, when I got it, I was brushing too fast. I didn't realize how long 2 minutes is.
And you put it up to the gum area and,
You literally hold it on each tooth and just move it. And you let the toothbrush, it goes at a 45-degree angle super fast. So you just hold it on each tooth.
so it
On
should
the
take you about
inside.
2 minutes?
My Sonicare actually has a quadrant spacer. So you divide your mouth in 4. And after 30 seconds, you hear a beep. So you spend 30 seconds on one quadrant. Beep, the other side, beep. So you end up doing a full 2 minutes of thorough brushing. So that's the best one.
And should you brush?
But